Welcome to today's webinar, Unlock the Value of Instrument Read Rapid Drug Testing, brought to you by our host today. Our sponsor is Abbott Technologies. Abbott creates life-changing technologies and products that help people live healthier, fuller lives. With a proven history under the established eScreen brand, Abbott is your trusted partner to deliver substance abuse testing and occupational health services that help you achieve a safe, healthy, and productive workplace. If you would like more information about the available products and services from Abbott, contact marketing@escreen.com for more information. Today's presentation has pre-qualified for continuing education credits from HRCI, SHRM, and CCDAP for those who attend today's presentation in its entirety. That's for the live presentation attendance. We'd like to welcome our presenter today, Bill Current from the Current Consulting Group. Bill is the former Vice President of Consulting at Employee Information Services, the former Executive Director of the American Council for Drug Education, and the Director of the Institute for a Drug-Free Workplace. He's authored 10 books on substance abuse prevention and drug testing. He founded Current Consulting Group in 1998, and it has become the #1 recognized brand name in compliance, business development, and operations consulting in the drug testing industry. He created Current Compliance, the most up-to-date and comprehensive online subscription database on all state law related to workplace drug testing, including marijuana and workers' compensation laws. And so we'd like to go ahead and turn the virtual microphone over to you, Bill.
Right, thank you, Jessica, and welcome everyone to today's webinar presentation. I am excited about this topic, which I'm going to get into in a minute, but I want to just also thank Abbott for sponsoring today's presentation. I have been associated with Abbott in one way or another for a number of years, and of course they are one of the top recognized brands in the drug testing industry. Every year at the Current Consulting Group, we conduct two different surveys, two public surveys, one of the drug testing industry and one survey devoted to employers. And those surveys are key indicators of various trends that are going on in the industry. But as part of the industry survey, we ask a series of brand name recognition questions. And in a number of categories, Abbott scores always in the top 3, but #1 in a number of categories. And so we're grateful for this opportunity to present this information and to do it with Abbott as our sponsor. Now, as you looked at the webinar invitation, you saw the outline of what we're going to cover today, and that's what's on the screen here. But I'd like to invite you to submit any questions that you have about today's topic or things related to today's topic, other issues that you may be aware of that or wondering about. You'll see that I'm going to talk a little bit about state laws as they relate to rapid testing and instrument read rapid testing in particular. But any kind of questions that you have, please feel free to submit them, and we'll leave time at the end of today's formal presentation to address as many questions as we can. And if you'd like more information from Abbott about some of the things we're going to talk about today, there's going to be a post-webinar survey, and you'll have an opportunity to indicate there as well. Throughout today's presentation, there are going to be 4 different poll questions where you'll be able to have some input into the presentation. And that information is very valuable in terms of not just knowing who's on the call today and what's important to you, but in terms of identifying topics for future webinar presentations. So I know ourselves here at Current Consulting Group and the folks at Abbott would appreciate your participation in those poll questions. So let's go ahead and get started. As just sort of an introduction, I get asked the question all the time about, what's the future of drug testing look like? And I am a firm believer that drug testing is here to stay, even with the legalization of marijuana having an effect on workplace drug testing programs. I don't see drug testing going away at all. I see it increasing, actually, because we're seeing evidence through a number of different sources, but particularly the National Survey of Drug Use and Health from the federal government, that drug abuse is going up. And we know that positive drug test results in states that have legalized marijuana for recreational use are higher than states that only have medical marijuana laws or no legalization at all. And so those are having, the rise in drug abuse is having a direct impact on the workplace, on safety and productivity. So I don't see drug testing going away. I do see, this is just my personal opinion, but I do see changes in how employers conduct drug testing. I think rapid result drug testing will definitely be a bigger part of the future. And I've got some results from our surveys to kind of help us understand where that trend is heading. I think as we look at rapid testing, and there are a lot of benefits to it, I'm going to go through that in today's presentation, but we're also hearing from many employers that they're still not comfortable having their own employees or even professional collectors visually interpret rapid result device results. And so I think you're going to see a trend toward instrument read rapid testing reader systems. We're going to talk about that today. I'm going to show you some pictures of the Abbott eReader Plus. But part of it's because, well, employers are not necessarily comfortable with their employees reading the result of a rapid test. And there's some great products on the market. As I mentioned, Abbott is annually recognized as the top brand in rapid drug testing devices. But you want a result that is, as you see there on the third bullet in orange, objectively read, and the results are there's no bias in the reporting of the results. The whole collection site flow, because a lot of this will take place at collection sites with the reader system, a lot of that flow is just improved. It's streamlined, and so it's good for the employer because they want those rapid results, but it's also good for the collection site because it increases or improves the workflow of getting people in, getting a test done, getting a result out the door. And so I think there's some confidence in that process that is appealing to employers and will be even more so in the future as you see a rise in rapid result testing. So let's talk about rapid testing in particular. And you see the picture there is an example of one of the Abbott products. So, and I'm going to show you how that works in a minute. But rapid testing in general, regardless of whether it's oral fluid or urine, although most rapid testing today is still urine testing, but it streamlines the entire drug testing process from beginning to end. It's more convenient. If you choose to, you could even do the collections on site, although with a instrument read device, you're going to want to typically work through a clinic. There's the flexibility that I mentioned there between having an employee do it and a professional do it, but it improves the donor experience. And this is a big issue right now in the drug testing world because there's a lot of competition for the best job applicants. And if the drug test result is going to be delayed a day or two or three because you're working through a laboratory and you're not using rapid testing, that donor's whole goal today is to get a job by the end of the day. And so they may move on to the next job interview where they're doing rapid testing. Maybe they're doing it with an instrument read device, and they're going to take that job because a lab-based test is not going to yield a result for at least 24 hours, but sometimes longer. And I'm going to talk about that in a minute as well. And one of the things employers want to be able to do, and we're seeing a more priority placed on this, is being able to make same-day hiring decisions and putting employees back to work faster following accidents and reasonable suspicion scenarios. And so that same-day hiring capability is becoming more and more important to employers. And so the rapid testing, generally speaking, makes that possible, right? Because the majority of drug tests are negative. And so in most cases, you're going to get that rapid result device the rapid test result immediately within minutes, and you're going to be able to make a hiring decision right on the spot because this is the person you wanted to hire in the first place. But now you've got the final piece of the puzzle, a negative drug test result, and you can put that person to work driving a delivery van or whatever the case may be because they tested negative and they're ready to go. And in the case of a post-accident test or a reasonable suspicion test, even though the positive percentages are a little bit higher in both of those situations, especially with reasonable suspicion, still the majority of those tests are negative. And so you're able to put that individual back to work faster, get them back on the production line, so to speak. Now, specifically as it relates to instrument read rapid result testing. And on the right is a picture of the e-reader plus. This is the Abbott reader system, the instrument read device. It's an electronic device, okay? And let me just look at those 3 bullets because it's sort of one sentence there, right? The electronic device is used to objectively test, read, and report results. And this simplifies the collection site's workflow, as I mentioned earlier, and removes the subjectivity of human interpretation. So you're really sort of getting the best of both worlds with instrument read rapid testing. You're getting a rapid result, but you're not asking somebody to look at the test and determine whether it's positive or negative or non-negative and negative. And so there are a lot of great products on the market, rapid result tests that are not part of a reader system. I get that. But if that's your concern, if you want to take the subjectivity out of it, and you're a collection site, for example, and you want to be able to offer rapid result testing, but with some type of an instrument read result, then that's a solution. That's something that as a collection site, you can say, we offer this, we have this available, and you'll see a lot of employers, I think, in the future looking for the benefits of rapid testing, but with an instrument read process. So let's go to one of our slides on from this year's survey. So up in the upper left corner, you can see this is from our industry survey. This is the survey that we released the results of at the NDASA conference back in May. And it's a survey of drug testing professionals. And we asked the question, do you have clients who use point of collection, POCT, or rapid result devices? Now, on the right, the big blue slice of the pie there, 81% said, yes, we have clients who use rapid urine testing. And on the right, slightly smaller slice of the pie, 54% who said, yes, we use oral fluid point of collection or rapid testing. Now, these results don't say how many of their clients are using rapid testing. Let's look at the focus on the blue slice of the pie here for a second. 81% of drug testing providers have clients who use rapid result testing. Doesn't mean that 81% of their clients use it, but 81% of providers, excuse me, who participated in our survey said, yes, we have clients that use rapid testing. Now, if you go back in time, we've been doing this survey of the drug testing industry now. This was our 26th annual survey, so we've been doing it a long time. But if you go back in time, you'll see that there's been a steady increase in the percentage of drug testing providers who say they have clients that use rapid urine testing. So we're seeing that increase. Again, it doesn't say how many clients are using it, just that 81% of the participants in the survey say, yes, we have clients that use rapid urine testing. And the 54% on the oral fluid side that's a very good percentage for oral fluid testing. Again, urine testing tends to dominate. I think we'll see more growth on the oral fluid side, at some point. But urine testing tends to be the dominant drug testing method. And Abbott sells both, right? So they sell rapid urine and rapid oral fluid testing. But with the reader system, we're talking about rapid urine testing. And urine lends itself well to the use of an instrument in interpreting the results. Let me show you a few other things to go along with that. So again, as part of our industry survey, we asked the question, will POCT or rapid testing increase or decrease in the next 3 years? What's it going to be like, between now and say 2028? 68% indicated that they think rapid testing will increase over the next 3 years. 5% said they think it will decrease. Right in the middle, 28% said it will stay the same. So that's sort of, the neutral ground in the middle there. It doesn't mean it's going to go up or down, and it doesn't indicate what percentage they're currently at with their client base. But most people in the drug testing profession believe that over the next 3 years, the use of rapid result testing devices is going to increase. And I agree with that. Now, what's driving that trend, those trends, okay? Well, one is the economy, of course, with companies needing to look at ways to streamline the drug testing process so they can be as economical and cost effective as possible. Certainly competitive hiring markets, which we see all across the country, but particularly in certain industries. And then to some extent, the legalization of marijuana. which is moving employers toward getting the drug test done as quickly as possible and getting a result that they can use to make employment decisions. Now, there are some trends in the drug testing world itself, in the drug testing industry. And so we asked the question, have laboratory turnaround times changed in the last year? Is it taking longer, or is it shorter, or is it the same to get a result back from a laboratory? Now, if you're not doing rapid testing at all and you're relying solely on lab-based testing, that's great. That most tests are that way still, okay? But we have seen an indication within the industry that, as you can see, the orange section of the pie there, that most people in the industry, 38%, I shouldn't say most, but a healthy percentage are indicating that they're seeing an increase in how long it takes labs to get results back to them. Now, that could be the initial screen negative result, good to go. Did we get that result back in 24 hours, which was always in the past the standard? Well, the survey didn't go into that much detail, but 38% said they've seen an increase, that it's taking longer to get results back. On the flip side, 52% said it's the same. That doesn't mean it's shorter or longer or acceptable or unacceptable, but 52% said they haven't seen any movement on that at all, okay? Now, we also asked about scheduling and logistics challenges when it comes to traditional drug testing, and by traditional, I mean a lab-based test. And so you can see that on the far left, 43% said occasionally we're having challenges scheduling tests and getting people in and out of a collection site as part of that process. 17% said frequently. Look all the way on the right, 8% said never, and the blue bar, 32% said rarely. So it's a little bit of almost a half and half, it's 60-40, but there's some concern there about drug testing being as user-friendly as possible. And so rapid testing addresses some of those issues, right? Because you're getting the result right away. The individual is in and out of the collection facility. The instrument has interpreted the result. It's electronically made available, and you get the result. If it's negative, you get the result within minutes. If it's non-negative and the specimen has to be sent to a laboratory, then of course now we're into that laboratory process. But the majority of drug tests are negative, and you're going to get that result back very quickly. You're going to know it automatically, and then you're going to be able to make a hiring decision or some other type of decision, regarding the employment of that individual. So those are some of the challenges that people in the drug testing industry are facing, and of course their challenges are a reflection of their clients' challenges. So with that, let's pause for a second. Let me turn it back over to Jessica, and let's look at our first poll question.
All right, thank you, Bill. So our first poll question asked, do you use rapid result testing? And so I'm going to give you these options on your screen. Yes with urine, yes with oral fluid, yes with both urine and oral fluid, not currently, but I'd like to learn more, and not convinced yet. So if you go ahead and share with us your thoughts there, we appreciate your participation. And then it looks like we're slowing down, so I'll go ahead and share those results with you. So it looks like yes with urine had about 34%, yes with oral fluid had 9%, yes both with urine and oral fluid at 34%, 21% would like to learn more, but they're not currently, and 2% are not convinced yet, Bill. So I'm going to go ahead and hide that and send it back to you.
Okay, thank you, Jessica. That's really insightful. Thank you for participating in that poll. To see so many people indicating, yes, they're currently using rapid testing, and yes, they're currently using both rapid testing with urine and with oral fluid. So thank you for doing that. That's great information. And we'll talk a little bit more about rapid instrument read testing in a poll that's coming up in a second. So let's move on to how instrument read rapid tests work. And I'm going to start out again with a little bit of information from our employer survey. So this was the second survey we conducted in 2024. The first was industry-based. This one was a survey of employers. How likely would you be to move from lab-based testing to rapid testing in the next 1 to 2 years? And I put that you'll see that little reminder in the box there on the right about the industry results and how many people in the industry have clients that are using rapid testing. But I want to start out by looking, we've got 22% there that say they're very likely or likely to switch from lab-based to rapid testing. And then below that, you got 25% that said not likely and 22% that said very unlikely. But right in the middle is 31% that said they're neutral. And by that, and we didn't ask them to indicate why they're neutral, but I think what it means is that they're on the fence still. They're still looking at the issue. They're probably among the people in the poll question that we just did that said, not convinced yet, I'd like to learn more about it. And so I think there's an education process going on there. But the 22% at the top that said they're very likely or likely, let me put this in the context of, say the last 20 years, because we've been asking questions like this in different formats for a couple of decades now as part of this survey. And we've definitely seen an increase in employers. Now, the employer survey, this is only in its 8th year, okay? So when I say 2 decades, I'm referring to the industry survey. But we're definitely seeing more of a movement toward, or an open-mindedness toward, rapid result testing. And so when you ask an employer, are you very likely or likely to move from lab-based to rapid testing in the next 12 to 24 months? Those are pretty significant percentages, especially as you look to the box on the right that shows that a high percentage of drug testing providers are already providing rapid testing services to their clients. Now let's look at another part of the employer survey. What percentage of your current lab-based volume would you transition to rapid tests in the next 1 to 2 years? This is a different question, right? Some people say, yeah, I'm looking at doing it, but would it be 100% of their volume? 11% said yes, or something less than that, right? 7% said 75% of their tests, 10% said 50%, etc. The point here is that some companies are obviously, going to be in that long purple bar at the bottom that are say, I suspect that group, the 54%, are companies that are maybe already doing rapid testing. There's no volume to transfer over. They're in many cases, they're probably companies that are covered under the DOT regulations, and they're not allowed to use rapid testing yet. They're doing lab-based urine testing completely. We know that lab-based oral fluid testing is on the horizon. We're still waiting for a few of the qualifications to be met for that, but those regulations are out there, they're in place. So there's various reasons why a company might fall into that not applicable category. But I think it's interesting that about 1 in 10 employers say, I'd probably move all of my drug testing over to rapid. And 28% total would be at least half. So you may be looking at a hybrid program, right? A company that's doing some of their testing through a lab and some of their testing with rapid result testing. Maybe they're doing all their pre-employment with rapid and they're doing employee testing through a laboratory. Or maybe they're doing their DOT testing as required with a laboratory, but all of their non-DOT testing of employees that are not covered under the regulations, maybe that's all rapid testing. There's lots of different ways that you can kind of slice that pie, but it indicates that there are employers that are looking at maybe a hybrid type of program where they're using both methods, lab-based and rapid result testing. Now, more specifically, instrument-read rapid result testing. As I mentioned earlier, there may be employers that don't want the added responsibility of having individuals in their employ or at a collection site interpreting the result from the rapid test. As I mentioned, there's some great products on the market. Abbott has some of them where they're very easy to read, but they don't want that responsibility. They would prefer that an instrument-read result tell them whether the test was negative or positive, right? And I think that's going to meet a lot of needs in the future. That's going to be a test that is going to take place at a clinic, but it's going to be a rapid result. And you're not asking anybody to actually interpret the result by looking at the cup and determining whether it's positive or negative. The reader system does that for you. The instrument does that for you. It's all electronic. And it eliminates that subjectivity of having possible, potential bias, unintentional as it may be, but possible potential bias. And you still get the confidentiality that you see there on the last bullet, the precision of the result itself, and the consistency. So over the years, we've asked employers, what's your #1 priority when it comes to drug testing? You're going to do drug testing. It's legal. There's no state law problems where you're at, etc. You're doing it. What is the number one thing you're looking at from a drug test result. And many employers will say an accurate, legally defensible result. And that's what you get with the instrument read rapid result test. You get all the benefits of a rapid result, but it's instrument read. And that's not to sort of disparage the other products that are on the market that are not used through a reader system, but that instrument read result just adds a level of confidence in the testing process that I think many employers are going to be looking for. Now, those 3 bullets, let me read the 3 bullets in bold blue. Employers realize all the benefits of rapid testing. The collection site benefits by being able to offer rapid result testing, but with an instrument read result, okay? And then look at that last bullet. This is key for the collection sites where the testing is going to take place. It optimizes the workflow in that clinic. It frees up individuals to do other things that they need to be doing, that they're hired to do, that they're expected to do every day, without having to interpret the result of a rapid testing device. Okay, so the instrument is doing a lot of the work that a collector might normally do. It doesn't necessarily eliminate the collector entirely, but it does eliminate the interpretation of the result, and it optimizes, as I say, the testing workflow at that collection site. So the advantages for the employers, they get the rapid result, they have an instrument read result, so they've got confidence in that part of it. But for the clinic, it's those things as well, and like I said, being able to offer rapid result testing with an instrument read result, but also it just makes the workflow smoother and more streamlined in that facility. Now, there are things you got to take into consideration when it comes to an instrument read rapid test, okay? The drug test panel, excuse me. The drug test panel itself. What options do you have? What drugs can you test for? I've got some more information coming up on that in a second. The track record of the provider that you're working with, the reader system, the cup, etc. I want to pause on this for a second because a lot of the bullets underneath this fall under the track record of the company you're working with. We live in the age of drug testing technology. The advancement in both urine, oral fluid, and hair, and the availability of different products and different methods out there has never been more plentiful than it is right now. And I've been in this business for 35 years now. I point that out because there are a lot of products that come on the market every year. I see them all the time. We get approached at Current Consulting Group by lots of companies that are trying to break into the industry. That's hard to do, right? Because you're competing with brands like Abbott and others that have a long track record of success in customer service. And when you talk about customer service and you're a company, let's say you're the employer or even the clinic for that matter, but you're looking at adding rapid testing to your program and you're looking at doing it with an instrument read process. That customer service becomes critical at that point, right? Because you're just going to have questions. Things are going to come up during the process of the test, and you're going to occasionally have test questions. You want to be able to get a hold of somebody. You want to have a rep who knows what they're talking about and who can answer your questions. So that track record, especially as it applies to customer service, is critically important. And the turnaround time on negative results is also very important with any reader system. So what I've described here and what I'm going to show you in a minute is a process that for negative results takes a matter of just a handful of minutes, a few minutes. You want to work with somebody who can send that sample to the laboratory for confirmation testing if it's a non-negative. Real-time status updates throughout the testing process. I like that. Electronic real-time status updates and secure results reporting via a web application. So you're getting the results via the system automatically. You don't have to call somebody. You're not waiting for somebody to fax something to you or email something to you. It's there in the system that's been set up for you. So not everybody can offer that. You want to look for those benefits when you're selecting a rapid test with a reader system. And also the network of collection sites that are electronically connected to one another, right? So maybe you're a multi-state employer, or you have locations throughout a big state like Texas or Florida or New York, etc. And you want to be working with a company that has an expansive network of collection sites that have the reader instrument in their facilities, or in the facilities of the collection sites that you're going to be using. So let's pause again and go to poll question number 2, Jessica.
All right, here we go. So poll question number 2 asks, would you consider instrument read rapid result testing? Let's go ahead and launch your options here. We already use instrument read rapid testing. Yes, I'm very interested. Maybe, but I need to learn more about it. Not currently, maybe in the future, not convinced yet. And remember, if as you're going through and participating, which of course we greatly appreciate, if you have any questions for today's presenter, for Bill, go ahead and put those into the questions section. If we have time for those at the end of the presentation, we will answer them live here. Otherwise, we will reach out to you with answers. But please make sure you have a question, share your question in the question section. So it looks like we're slowing down here. And so I'm going to go ahead and share the results of this poll with you all. 35% said we already use instrument read rapid result testing. 16% said, yes, I'm very interested. 32% said maybe, but I need to learn more about it. 15% not currently, but maybe in the future. And 2% are not convinced yet. So I will hide that and send it back to you, Bill.
Thank you, Jessica. Again, thank you for your input on these polls. It's great insights right there. I'm a little bit surprised that such a high percentage are already using instrument read rapid testing. So you may be able to send in some questions based on your experience using it. So please feel free to do that. We'd love to hear from you. So we're going to switch to one of my favorite topics when we're talking about any kind of quote unquote new drug testing method, or new to you anyway. Is it legal? Is it accurate? And is it practical? And when I say is it legal, I'm talking about at the state level. I'm going to talk about state drug testing laws more specifically here on another slide. I'm not talking about the federal regulations, because it's not as if it's illegal in the federal regulations. It's just that under the DOT regulations, for example, only lab-based testing is permitted. I've not heard them say they don't like rapid testing, but it's a long process. And people in the industry who know the whole process that oral fluid testing went through to become an approved specimen for DOT testing know that it took, better than 10 years for that whole process to play out. And that's lab-based testing. But is it legal? Is it accurate? Is it practical? Okay, so legal, instrument read rapid testing is permitted wherever rapid testing is permitted, with few exceptions. Okay, in other words, the first thing you want to look at is rapid testing permitted. And in every case where rapid testing is permitted, rapid urine testing is permitted. Now, there are some states where rapid oral fluid is not yet permitted. It's a small list, but rapid urine testing is almost, that's never a question. If rapid testing is permitted, rapid or urine testing is permitted. And almost always, without exception, you could apply it to an instrument read rapid testing program. Now, is it accurate? Yeah, but a lot depends on the device that you're using and the reader system. So you could go back, when you get the link for the recording of today's presentation, go back to the slide on key issues to consider, and that will give you a good sort of barometer as to the accuracy of the test, and also the practicality of using the test. What I mean by that is on a day-to-day basis, from hour to hour, day-to-day, week to week, does it work for us? Is it practical? And I think for many people who want that rapid result test and all the benefits of rapid testing, they're going to like the prospect of a reader system, an instrument read result. So let me talk about state laws for a second here. And we won't spend a lot of time on this, but we did in a previous webinar that Abbott and Current Consulting Group did, and you could find that there if you'd like more information about the state laws and rapid testing. But when you're talking about state laws, because you're going to need to research this, I think you're going to find that in almost all circumstances, rapid testing with urine, with a reader system is going to be copacetic, no problem. But you want to look at the different types of laws that apply, mandatory versus voluntary laws. This is important because states either have a mandatory law a voluntary law, or they're governed by case law. As in the case of California, it's mostly case law that governs workplace drug testing in California. Here in Florida, where I live, we have a voluntary drug testing law. The requirements to participate in that voluntary program and get a 5% discount on my workers' compensation premiums here in Florida requires me to test a certain way. But outside of that voluntary law, and this is the case in any state that has a voluntary law like Georgia, Tennessee, etc., outside of the voluntary law, if you're not participating in that voluntary workers' comp discount program, then you're free to drug test as you wish, within reason, of course. But as part of that voluntary law, you'll find that many states require a lab-based testing program. Not always, but sometimes. So look at the kind of law that you have, or whether it's case law driven, as in the case in California. Now, I will say, now that I've mentioned California, you can do rapid urine and rapid oral fluid testing in California, although there are limits on testing for marijuana with urine in California and Washington. So look at those closely. That's not the subject of today's webinar presentation, but I would just caution you to look at that closely. Workers and unemployment compensation laws, if you're looking to work to move to deny benefits based on a positive result, there may be certain stipulations as to how you conduct drug testing. Look at those. There are some states with industry-specific laws, Illinois for public works contractors, West Virginia with the mining industry, etc. So you look at those requirements if you fall into those industry categories. And then, of course, the medical marijuana and recreational marijuana laws. Those definitely come into play nowadays. They don't typically dictate how drug testing is conducted, but there are certain conditions in many of those laws that might affect your decisions about your drug testing program. So look at those very carefully. Now, what to look in those state laws is rapid result testing permitted, prohibited, or not mentioned at all. Is it urine? Is it oral fluid? I kind of addressed that already. Look specifically at any kind of collection procedure requirements. Who's authorized to perform a collection? Where can the collection take place? If you're using a typical occupational health clinic of some sort, let's stick to that just as one category, and you're working with certified collectors, you're pretty safe when it comes to rapid testing using an instrument read system. So that wouldn't be a concern, but you want to look at what the state law says about that. But typically, that's the ideal process that a state law is looking for, a collection that takes place in a collection site with a certified collector that meets certain requirements. There are not a lot of states that go into the details of that collector requirement, but there are some. Just look for that, okay? And all these other requirements down here underneath that. And then also look for any references to the DOT SAMHSA Part 40 standards. Sometimes states will defer to the federal regulations as to how drug testing and how collections take place. And even in many of those instances where they defer to the federal regulations, if you're using a clinic and you're using a reader system or an instrument read rapid test, unless it specifically doesn't allow rapid testing, which is not going to be the case very often, you're pretty safe again with an instrument read rapid test. And then any language in the state law regarding confirmation testing or MO verification, which you're going to want to do anyway if your rapid result, instrument read result comes up non-negative. Now, let me say this about the DOT regulations. We all understand that under the DOT regulations, you must use a laboratory, lab-based urine, and eventually at some point in the near future, lab-based oral fluid testing. But again, I want to point this out. You could have a hybrid program where you're following the DOT regulations to the T when it comes to testing your DOT covered workers and applicants. But outside of that, you could use rapid testing, and it can be through a clinic with an instrument read result for your non-DOT workers. Again, you're following the state law, okay? But you can use a hybrid system or program where you're getting the best of both worlds. You're following the DOT requirements, but outside of those DOT situations, you're using a rapid result, instrument read result system for your non-DOT covered workers. I like that. I think that works for a lot of companies that are going to want the benefits of rapid testing, but at the same time, they may have some employees that fall under the DOT regulations. Okay, poll number 3, Jessica, are you ready?
I sure am. All right, let's see, participants, are you all ready? Are you located in a state that permits rapid result testing? Let's go ahead and give you an opportunity to participate. Yes, yes, but not all states in which we are located. No, I don't know. Can you tell me? And we'll go ahead and share these results. 73% said yes, they are in a state that permits rapid testing. 13 said yes, but not all the states we're located in. 5% said no, and 9% would like to know. So let's turn that back over to you, Bill.
Okay, and for you 9% who marked I don't know, can you tell me? Put it in the chat or the question section and tell us what state or states you're in. We'll answer that question for you. I'm gonna predict though that the vast majority of you are in states where rapid testing is permitted and where an instrument read rapid result is also permitted. But to be sure, let us know the states you're in and we'll answer that question for you. Okay. Now we're quickly coming in for a landing here. So let's go to our final section, which is converting to instrument read rapid result testing. Now, I think in the future, employers are going to want to see a more efficient drug testing processes that they can plug into so they can get faster results that are just as accurate as their lab-based drug testing program has been all these years, but that's faster. Just everything is sped up so they can make faster hiring and employment-related decisions. A legally defensible result, of course, like I talked about earlier, but one that's cost-effective that makes it possible to fit drug testing into their future budgets as the economy continues to kind of put the squeeze on programs like drug testing. So now these next 3 slides are specific to, well, not this one particularly, but the next 2 I like because I've got some pictures coming up that I really like and I want to share with you. But considerations for selecting an instrument read solution, device technology, the collector workflow that we've talked about, and environmental factors. So in the interest of time, I'll just kind of briefly go over the multiple options that there are multiple options on the market today. There are tablet, phone-based systems. There are small compact units that rely on cameras to read the result from a urine cup, etc. So look very carefully at the technology that's used in a reader system that you're considering, and make sure that it works under the conditions that are convenient to you and that give you the confidence and the security that you're going to get a result you can rely on. If it's ever challenged, boom, you know that you've got a legally defensible, accurate result. So look at that. Go back to that list of things I talked about earlier, which is like the track record of the provider that you're working with. And then environmental factors. That is an important consideration because, as just one example, if you're using a device or a reader system that relies on, say, perfect lighting in the room, because it's not sort of a closed system, the reader is not a closed system, you're going to want to make sure that the facility that you're using can accommodate that, and that it's not going to interfere with the reading of the result or the accuracy of the result that's delivered. So if you go to this next slide here, now at the bottom you see the eReader Plus with from Abbott, and I'm using this as an example because as you look, you put the cup into the system, it locks into place, and then you actually close the lid. You close the door, and the result is in there, and it's unaffected by external factors. You're going to get the fast, accurate, automated result. Okay, you're going to get all of that. You're going to eliminate human error because the system is doing all the work, and it automatically reports the negative results really within minutes. I mean, that's what you're looking for, because the vast majority of the tests are going to be negative, and you're going to get those results in 3 to 5 minutes, and then boom, you're off to the races to make your employment decision. But also in this day and age, and I don't know if you saw that, I'm not saying that the system, the eCup Plus does this, or the eReaders Plus system does this, but I don't know if you saw that news yesterday about pink cocaine. It's not actually cocaine, but it's called pink cocaine, but it's another, sort of advancement in the types of substances that people are using to affect their bodies. And I thought it was really interesting, but more to the point of our discussion here, there are lots of drugs, common prescription drugs, and even illicit drugs that people are using, and you want to be able to use a system with a cup and a process that can detect more than just the regular SAMHSA 5 drugs that are part of the DOT test, right? In today's day and age, it's a lot of different substances that are out there, and you want to be able to pick and choose the substances that you're going to test for. So you want flexible panel options, okay? And I really want to emphasize item number 4, which is the easy administration, so that the collection process and the reporting process are streamlined, and you don't have to do a lot of work to get that. You send the individual to the collection facility, and the technology does almost all the work for you. I'm not saying it eliminates, people involvement entirely. That's not what I'm suggesting, but the system's doing it for you. The technology is such that you don't have to do some of the things that, or the collector doesn't have to do some of the things that have been done, by people in the past. It saves time, you get a fast result, and it eliminates the subjectivity in the drug testing process. So more about that. And one of the questions we're going to ask in the follow-up survey is, would you like more information from Abbott about eScreen 123 and the My eScreen technology? And so if you're interested in learning more about that, let them know. We'll pass on the information, your contact and name information, so that somebody there at Abbott can get a hold of you. Now, I want to just put this reminder up here from one of our earlier slides. How likely would you be to move from lab-based testing to rapid result testing in the next year or two? We did not ask specifically about rapid instrument read testing. So I think that may be something we want to add to next year's survey. But this was interesting, right? Because we talked about the 22% who are very likely or likely, but then that 31% who are still on the fence, right? So those top 2 bars are people that they have been impressed by everything about rapid testing, and they're very likely or likely to switch from lab testing to rapid testing. But there's still a big percentage of employers out there, 31%, who are looking for more information, and they want to see how this would fit for their workplaces. And maybe they're not aware of the technology of an instrument read rapid test, and once they're aware of that, it would help them make the decision to go toward rapid testing, because they take the subjectivity out of it, and the instrument does all the heavy lifting, so to speak. So we've got one more poll question, and then we'll land the plane.
Okay, here we go. Last poll question. Which of the following would be your preference when conducting rapid result testing? So conducting the test at the workplace with professional collectors, conducting the test at a workplace with trained employees, off-site utilizing instrument read rapid result testing, or a combination of on-site and collection. Looks like we're ready to share the results. And we have 13% said at the workplace with professional collectors, 15% said at the workplace with trained employees, 23% said off-site utilizing instrument read, and 49% said a combination of on-site and collection site testing. So back to you, Bill.
Very interesting. Thank you again for your participation in the poll questions. If you want more information about that whole process, let us know. Put it in the chat section or the question section. We'll make sure somebody from Abbott gets back to you. Let me conclude by saying this. I believe drug testing's never been more important. We're seeing increases in drug abuse at record levels, and we're also seeing like a 25-year high in post-accident positive drug test results. So we know that as drug use goes up, it affects the workplace, and sometimes in very negative ways. Now, can employers continue to do drug testing? They see the value, but there are challenges, right? They need to fit it into their budget, and the economy kind of pushes back on that. So they need it to be as economical and cost effective as possible. It also needs to help them solve the problem of, excuse me, being able to hire people in a very competitive hiring market, especially in certain industries like retail and fast food, et cetera. And then they need to maneuver around these legal marijuana laws, in some cases that place conditions on employers when they're testing for marijuana and they get a positive, and what can they do with it? So that's part of the equation that they're dealing with. Excuse me. Rapid testing does save time, it does cut costs, it works for a lot of employers. We saw a lot of that today in our survey results, in the poll questions. An instrument read rapid test eliminates the subjectivity of the human interpretation, as it says there in the second bullet, and potential bias that could enter in. And instrument read results help maintain confidentiality, precision, and consistency. So with that, let me open it up, Jessica, to any questions that our audience may have.
Excellent. Yes, for sure. So while we open it up for questions, we just wanted to remind our participants here today to submit your questions, of course. We wanted to just stress to you that if anything in this presentation has piqued your interest, but we haven't discussed it, and there's more questions, you can put them here. But also, as you sign off the webinar, there, as we mentioned earlier, there's a survey and there is a place for comments at the end of the survey. So if you want to just put it there, you're not worried about it being delivered answers here, then of course go ahead and share that with us. But one question is, please explain if a confirmation test is required before taking personnel action, risks of false negative or false positive from a rapid result test.
Well, with any test, if the initial screen is positive, which is what we're talking about with rapid testing, if it's non-negative, let's say, then you do want to do a confirmation test through a laboratory. And that confirmation test, if it is confirmed positive, should be verified by a medical review officer. And you're going to find that in most states, that's required. That whether you're using lab-based testing for the initial screen or rapid testing, if it's non-negative or positive, depending on which terminology you like to use, then you do want to use a laboratory to confirm the result, and if necessary, have an MRO verify the result.
That's helpful information, Bill. Thank you. Now, this question came in right as you were actually going into this section. It said, are there states that do not allow rapid result drug testing? But just to clarify, if you could just take a second to reiterate that point.
Well, the answer to that question is yes and no. Usually in a state that has and this is not always the case, but in a state that has a voluntary drug testing law, most of those laws were written many, many years ago, really before the advent of rapid testing, and the terminology that's used in that voluntary law is all lab-based testing. It may not be the intent, and that could change, but in many of those states, you're going to find the law includes laboratory-based testing language. In most states without voluntary laws, there are some that have laboratory licensing laws that start to bleed into workplace drug testing policies and procedures. And so you want to look at it on a state-by-state basis. The vast majority of states do allow rapid testing, but there are some, like I said, voluntary state laws, not all of them, but a few, and some states with laboratory licensing laws, like New York, for example, where the language of that laboratory licensing law would indicate that all testing has to be done through a laboratory. However, we found that not always to be the case. So you've got to look at each state on an individual basis.
Okay, great. So this kind of is in that same vein, but a little bit different use of a the rapid testing. So rapid testing is permitted in North Carolina. This is the question that was presented, so a little specific, but on a restricted basis. POCT is allowed for pre-employment only, as FDA approved devices and MRO review is required. So the question, I believe, is, since Abbott's rapid testing includes FDA devices and MRO review for non-negative specimens, is it possible to get an exception to allow this type of rapid testing for current employers, post-accident, random, and cause?
Yeah, and I think the answer to that is, I don't know. We'd have to look into it. It's a great question, though, and it makes a lot of sense, but we'd have to look into that. So I wouldn't want to venture a guess or a prediction on that, but I like that question. It makes sense to me. And if you'd like to pursue it, we'll look into that for you.
Wonderful. Thank you for that answer, Bill. We have a couple other questions that kind of fall into a similar vein as that last question where it's very specific. And so for those type of questions, we're going to save those for offline so that you can get the right information that's pertinent to how you would use this product or products like this from Abbott. And so for that purpose, we'll go ahead and start wrapping up. Again, we want to thank all of you who participated today in our polls and stayed with us for this information. We do appreciate your participation. We also want to thank Abbott for sponsoring today's webinar. Their contact information is again on the screen, marketing@escreen.com for more information. But also if you want to ask any other questions or comments as you leave the webinar in that post-webinar survey, we'll share that information with Abbott as well. And we wanted to just remind you that today's presentation was recorded and we will send you access to that recording. Bill mentioned a previous webinar that we had done with Abbott a couple months ago, and we'll go ahead and link that webinar as well when we send you the link to this webinar, just in case you missed that one and would like to review it. Another thing that we wanted to bring to your attention is that today's presentation has qualified for continuing education from HRCI, SHRM, CCDAP, and that was for those who attended the entire live presentation. So if you have been with us this whole time, then we will send you the continuing education information. And with that, we conclude today's webinar, and we thank you for your time and hope you have a wonderful day.